Medicine is so different in small communities versus larger communities.
When you're in a rural area, you have the opportunity to do a lot more.
I do inpatient work, I do hospital, for a teaching center. I really love the complete spectrum of rural care.
Here, the family doctor like myself is going through the whole thing. And that is something which is very central to understanding rural medicine. And that's why I love it.
Discovery Week is a one-week program at the end of first year where students go out into the rural communities and learn all about family medicine and other specialties.
The goal is to introduce students to medicine from outside of the tertiary care health center, to give them a real lived experience.
One of the really great things about Discovery Week is that the students have no idea what to expect. They could be assigned to the ER for the day, they could be doing house visits.
We try to make sure that they get a full exposure to all the kind of activities that are taking place in the hospital.
A program like Discovery Week is important because it teaches first-year medical students about what it's like to work in a smaller rural community, what it's like to be part of a healthcare team and have a wider scope of responsibility.
The learners expect from Discovery Week an honest opportunity to see what medicine is like. They've just spent 9 months in the classroom learning lots of book knowledge. This may be, for some, their first opportunity to be with a real patient.
It was unbelievable. I met so many different physicians. I had a chance to rotate through a lot of different services, and I got to work with elderly patients. I worked with babies. It was really a chance to witness all aspects of medicine in 1 week.
It's extremely rewarding to be able to teach them about your job, your specialty, or your interest.
I try to be an integral part of their experience here, and I try to guide them what is really exciting about being here.
The most rewarding part of engaging in a rural medical practice is that you're directly improving the community that you live in.
This is a very satisfying and a very productive experience because these medical students are going to be the doctors of tomorrow. They're going to be your colleagues. So you might as well form a bond and impart a very positive picture.
It underscores that tradition of mentorship in medicine. It really helps physicians show students that you can be doing all kinds of things and engaging in work that excites you and stimulates you. It's really encouraging to see physicians who love what they're doing.
The major takeaway is the excitement. Nothing like having a learner in your clinic to remind you of why you entered the discipline. Being involved with medical students affords us many different opportunities to feel like we're giving back.
What makes a good faculty member is someone who can convey a love for what they do, who are genuinely committed to teaching, who love showing different aspects of medicine and allowing students to engage in those things and pass on the knowledge that they've had.
At Schulich Medicine, we value anyone who is interested in helping medical students understand what it's like to be part of the healthcare system.
I highly recommend for any physicians out there to participate in Discovery Week.
Discovery Week can certainly change the way in which students see rural practice.
If you have a vested interest in seeing what the physicians of tomorrow are going to be like, want to impact upon their future, promote your community, be part of Discovery Week. Help us help them discover what's great about your community.